The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
It's Tuesday morning, and we are here for the next episode of TMD Demystified. I am Tony Urbanic. Today, the topic I've chosen and the title I've chosen applies to the dental professional, I think, in many ways. I think I have something significant to say here about how the doctor literally views what he is doing for the patient. It varies, the viewpoint on what we have to talk about varies between the patient's viewpoint and the doctor's viewpoint. To be specific, this came to my attention a long time ago, using this as an example. It's been a not unusual experience for me as a provider for the TMD device, which it does an excellent job of relieving TMD symptoms, to have patients exclaim how happy they are with the device. Multiple times, and one recently, which tripped this particular topic for today, was a duplicate of many patients I've had before. But this woman, after, I believe it was only 3 weeks, I walked in the room, examining room, with the patient who had worn the Urbanic device and followed the protocol, Urbanic device and protocol, which was 24/7, except when she ate for the first 3 weeks, having this little thing in her mouth, which separates the back teeth and unloads the temporomandibular joint. And I walked in the room and I said, Janie, how you doing? And she literally had this big smile on her face. She jumped out of the chair, stood up next to the chair, and held this little thing in her hand and exclaimed, "I can't believe this piece of plastic made my symptoms go away." That happened just like that. I just demonstrated. Can't see the device. I can't believe that little piece of plastic made all my symptoms go away. Now, what that means to me as the doctor, and this isn't the first time it happened, a patient exclaimed, "I can't believe this made my symptoms go away. I can't believe this little piece of plastic." That's what the little piece of plastic made my symptoms go away. So from the patient's point of view, that's what I'm trying to get across. First of all, doctor, is you need to understand, as a dentist, when you make a crown, when you make a denture, when you put in a dental implant, when you put a crown and a prosthetic piece on a dental implant that the surgeon put in, the patient point of view is that they are purchasing, or they are purchasing with the help of their insurance company, which we won't go into. Dental insurance is not insurance. Their dental plan company, it's not insurance. But the patient's point of view is they are purchasing a crown. They are purchasing a denture. And in this case, they are purchasing this little piece of plastic. And now, some patients kind of go with the flow and don't make much of it. But I've likewise had many patients during the consultation when I give them the fee for providing the service to make all of their symptoms go away, some patients look at me and they go, well, that's a deal, because whatever degree of discomfort they've been having for how many days, weeks, years, or decades, but to some patients, it's apparently a deal to pay X amount of dollars to make their symptoms go away. And other patients look at me quizzically, or sometimes a little antagonistically, in that they look at this piece of resin skeptically as to the expense of it. I think I'm making my point at first. So patients, from a dental point of view, more often than not, think that they are buying a crown, a bridge, a dental implant, or a TMD device. They're just buying a device versus buying a service. Now, let me expand on this just a little bit, doctor, because in the medical universe, I can promise you, because I walk both rails as a dental doctor, as a medical doctor, as a physician of the body and a physician of the oral cavity and associated structures, both. The medical profession and the people who deal in the medical profession and the people who go to medical professionals look at the exact same situation quite differently. Let me give you a great example. If a patient has a heart attack, a myocardial infarction, and they begin having severe chest pains, and they end up in the emergency department at the local hospital, and we have many excellent hospital systems here in Middle Tennessee and Nashville, 3 major hospital systems here in Middle Tennessee, not just hospitals, that have excellent cardiology and cardiovascular surgery assistance. So a patient goes into the emergency department with bad chest pains. They work him up, they put him on an ECG. He's scared. He knows what's going on. And cardiologist is called in. The cardiologist says, well, we need to get him to the cath lab within 30 minutes. And in Nashville, Tennessee, we're available to do that in 3 major systems. So the patient goes to the cath lab, they sedate him, and the doctor puts in a arterial stent in 1 or more vessels. The patient wakes up, and miraculously, their pain is gone. And after he gets through the first few hours of the post-surgical event, cardiologist comes in and says, you did really well. I expect you to have a full recovery. And patient's happy, the patient's family's happy. They're just ecstatic. Now, from a medical point of view, what happened there? What actually happened there is the cardiologist, the hospital team, the hospital system, the hospital team, the cardiologist, his cath lab assistants, who are highly trained on putting in a arterial stent into 1 or more of the arterial arteries, did a service for that patient, and the patient is just as happy, maybe not as happy as the patient who had 25 years, 30 years, 40 years of headaches, earaches, jaw pain, neck pain, who claims this little device made my pain go away. It's amazing. It's a miracle. I can't believe this little piece of plastic. But in the medical universe, the patient doesn't say, I can't believe this little piece of cobalt chromium or titanium stent made my symptoms go away. That is never said, ever. Patient doesn't jump out of this, I can't believe this little stent made my pain go away. No. Patient understands in the medical universe that there was a team approach and a lot of training and science and scientific research went into making their pain and their symptoms go away. You see the difference here. The medical profession, for some reason, and I can discuss it. I have my own opinion about that, and that's an opinion. But what I just went over is fact. It's fact. But the dental profession and the medical profession handles the exact same situation totally differently from the patient's point of view. But from the doctor's point of view, it's really identical. From the doctor's point of view, it took significant amount of time and effort and training and experience to develop this little piece of plastic, resin, or acrylic, depending on how you make it, that separates the back teeth, and then according to a protocol, it makes the symptoms go away. In my case, it took me 36 years of actually operating on temporomandibular joints to come to the conclusion that surgery was not going to be the ultimate answer, and then to go into the research that took several years and significant time and resources to come up with this device, how to make it, and then how to make it from originally in a dental lab using acrylic and ball clamps to make it CAD/CAM on a computer and 3D print it, doing the same thing, getting the same results, but it took considerable amount of time and research. Now, admittedly, not as much time, not as much research, and certainly did not have the resources that went into a cardiac catheterization lab, and the resources to buy and develop the cobalt, chromium, or titanium stents that are routinely placed in coronary arteries. But the concept is exactly the same. But the concept from the patient's point of view, talking to the dental or the medical industry, is totally different. Patients think when they go to the dental office, they're buying a crown, and it costs, let's just throw out what I think is the average fee, might be in your neighborhood a lot more, $1,500 for a crown. Oh my God, $1,500 for a crown. They have no realization. They don't think in medical terms. They think in dental terms. They're buying a crown. They're buying a denture. They're buying a device for the treatment of TMD, but they're buying a device. They're buying what most people call it a splint. Actually, most people, when they take a look at this device, I constantly remind them, you can call it a retainer if you'd like. Call it a retainer. You're not going to insult me. They say it looks like a retainer, and they can get their retainer from the local orthodontist for, I don't know, whatever an orthodontist charges for a retainer, $150 or less. That's not a retainer. It's a device that has been developed for the treatment of TMD that is extremely successful. So I made this point, and I hope I've made it very clear that, and this applies not to the doctors only who provide TMD services. It applies to everything that the dentist does, or just about everything the dentist does in his practice, and hopefully will stimulate the dentist to begin to change the concepts or the thought processes of his patients, that they're not buying a crown, they're not buying a bridge, they're not buying a dental implant. What they're purchasing, with the help, sometimes with the help of their dental plan, is to purchase a service that does an excellent service, and in our case, does an excellent service of providing remediation for all the TMD symptoms that the patients have suffered with, most often for years before they ever get in to see us. So this is fact. And I bring it to your attention as a thought process to look at this objectively and subjectively, because it is objective. Patients go in to see their medical doctor for a service. they're not buying a test tube full of blood when the phlebotomist pulls the blood from their vein and sends it to the medical lab. They're buying a service that is being done. They don't, grab that test tube full of blood. I can't believe that this little test tube full of blood is going to give me all of the answers to my problem. No, they're purchasing a service. And that has not been the case in dentistry. And so I emphasize to you, dental doctors, to consider this and to begin educating those around you. So you can start with your staff, because they, patients ask the staff more questions than they ask the doctor. I know that after 50 years of being an oral and maxillofacial surgeon. I'll give a patient a consult, very thorough consult, answer their questions and all other questions that come to my mind that other patients ask, give them a thorough consultation about what surgery I'm going to provide, why I'm going to do it, what their expectations are, what the possible complications are. And then they'll go right up to my assistant, or more importantly, the person in the front office who talks to them about insurance or money and paying for this, and ask sometimes the same questions that I just answered for them. And I think you all know that happens frequently, extremely frequently. So educating your staff on the fact that you're providing a service, not a crown, or a service for the remediation, resolution of all temporomandibular joint symptoms, versus the medical establishment, who patients go into the medical establishment knowing they're not buying a stent, and they're not buying a test tube of blood, and they're not buying an operation to take out their brain tumor. They're purchasing the relief of their big, big problems. They're purchasing a service, which entails all of the staff, all of the training, all of the science, all of the research that went into it, I don't think I could explain it any better. Now, what is the value of this? Well, I think the first value is that if patients will take that point of view, will accept that point of view, they're much more likely to accept the service. When they think that they're purchasing a piece of cobalt chromium, or they're purchasing a piece of resin, or they're purchasing a gold crown, they're less likely to accept that, because, my God, that crown, that little crown, is $1,500. Well, you can see that's it's not true. That's not what they have. When they get the big picture, the appropriate picture, the large picture, the picture that has been portrayed in the medical industry, in the medical profession since the beginning, then they're much more likely to close on the service, which is a benefit to both the patient and the doctor. Because I am certain that you are not promoting and selling services that are not necessary. Of course, you're selling services that are necessary. So that's my message for today. I hope it impinges on you. It's something for you to think about. It's something to be creative about, how you can get this message, not only beginning with your staff, but beginning to all the patients that see you. You may want to add something like this. You can write it up any way you want to your website. I think it is a very valuable piece of a doctor's website, is to explain, and a dentist, especially a dentist, not so much necessary in a medical doctor. They don't have to. When you go to the medical doctor, they expect to buy a service. When they go to a dentist, they're expecting to purchase a piece of stuff, a filling. Oh my God, that filling in my mouth costs $200 or $250 or whatever. You see my point of view, and you can be creative about how to get this message to the patient who ultimately you want to serve. and ultimately want to close on the services for their benefit. With that being said, I encourage anyone who listens or follows these episodes along to question me, to ask questions about anything, to criticize if you'd like, as long as you keep it civil. My biggest problem is I can't get people to criticize anything I say, and I encourage you to do so. I'm very careful. I want to give you factual information. I want to be able to have anyone fact check anything I say. And up until this date, I don't get critical communication. I wonder, it encourages me to think that what I try to teach, what I try to say is actually useful, beneficial, and factual. My website is www.urbanictmj.com. You can contact me directly at tony@tmjservices.net. Until next time, which will be on a Tuesday morning, I am Tony Urbanic, and this is TMD Demystified.